malaria. Last month, on the 25th of last month, now World Malaria Day. And I can't do small research. I can't say this malaria where all of us just they carry the talk. And sometimes, they to take seriously until don't carry us. Reach hospital, they can't set drip. They do all. This malaria not be waiting. We suppose take the joke. Because this malaria, from pregnancy stage till when they born and don't born the pikin finish, if it cause big problem, if it too serious and if it too frequent, if it cause where it be say pikin will call it get problem with learning, with reading, with writing, with understanding, and even some other behavioral problem go still fit come join, wey go make am difficult for the pikin to fit learn. So my people wey dey listen to us today, the first person wey we go give mic today na Dr. Danar Mark. And the question for Dr. Danar be say, wetin be the link between malaria for pregnant women and problems wey fit affect learning for children and general brain problem? Wetin be the link between malaria and all of this kind problem? Doctor.
Okay. Thank you very much, Mrs. Afiz. Malaria is very common in women. And women, because they are pregnant, their immunity is lower than other women. So their system no dey fit fight malaria like other system. And say a woman, she dey carry baby inside. If she get malaria, she fit no get symptom. She go just dey normal, she go just feel, she get small headache, she dey get back pain, her abdomen dey pain her. Before you know, malaria don dey inside her. And what the malaria does is that small thing wey they call placenta, where they comot food from mother, give the baby, the parasite they go stay there.
Yeah.
When they stay there, they jump from there, they enter the baby, jump from there, enter the baby, jump. So the baby will become smallish. In the mother's womb, the baby will become malnourished, and sometimes the baby can even die. Now, the babies that, if this malaria is not treated, and the babies survive and was given birth to, some of them, they can have this malaria transcending into their brains. So they can have to affect their learning process. It will affect their cognitive processes, motor processes, their behaviors and everything later in life. Some of them, they will go small. Smaller babies also have, studies have been shown, some studies have been shown that babies that are small have some developmental problem, have some cognitive problem, have some motor function disorders, and so they may have challenges in life. So malaria in women actually affect the learning process. That's why you see that you give birth to your child cried during birth, and they say people who child will cry suppose they're good for school, but your child is slowing. What happened? He had the malaria, he suffered malaria during pregnancy that was not identified and was not appropriately treated. So there is a link of a child.
Okay, I don't hear this one before. Thank you so much, Dr. Mark. I really happy say you come free join us for this program, and if you explain this matter to us well, because wetin me I know be say, especially for women wey be say they don't born before. I mean they don't born first pikin. No say because they don't born first pikin now, other pregnancy now that body wey they take carry first pikin, that experience now they will take they look the other pregnancy. You understand? Most times, us women, we know they feel they individualize our pregnancy.
Correct.
Are they wrong?
Very correct.
Because because we don't go through the process the first time. The second time we go say, even though we dey see some kind sign, we go say, it no matter.
I don't do it before.
We don't do it before. Our the pikin, we go not every pikin different, but at the end of the day, pregnancy na pregnancy. Body must change. You go just dey carry all of this excuse round this pregnancy. So what could be the advice now where you go give women? When you say they need to put for mind concerning this issue of malaria.
Now, first and foremost, women need to know. First, just as we always tell them when they come for antenatal, some of them don't listen. But you need to know that you need to prevent malaria at all costs.
Yeah.
Don't look at it as if it's only you, because you are carrying a baby there, and that baby self supposed gain everything from you.
Yes.
But the painful thing about malaria is that in women that are pregnant, sometimes they don't have the common symptoms that we have: fever, headache, joint. They will not have. You will just feel you're having some stomach ache, you're having some back pain. Some people, if they're severe, they will say, I'm feeling tired, It is that same malaria. But you should know that at that time, it's not you alone. It has entered the baby's system and it's affecting the baby. So the prevention first is very important, and knowing the early warning signs of malaria. Don't wait for you to have full-fledged fever, you go to get headache, you go to shiver, now you go hospital. No. When you start having those low abdominal pain, back pain, weakness of the body, small thing you do, you don't tire. Those ones are the early symptoms of malaria. Run. Don't go and take paracetamol. Okay. That's one thing. If you take paracetamol will just make you feel okay. But the malaria is still there.
The inside body.
So you could just take paracetamol. The malaria, they enter. So go where you go see a gynecologist or any good doctor. He will see you, he will run a test for you, and then he will pick the malaria certainly, and then he will give you the appropriate treatment. But why will you even wait for you to come with the malaria? Can't you do prevention? See mosquito net, then go give you mosquito net, you carry and they do cutting. Those things. So you protect yourself. Wear long clothing when you're at home. At night, close your doors. If you have mosquito repellent, use them. If you have boots, some people say you should wear boots, use them. In the night, you can lie down under mosquito net. Outside your compound, clear all your bushes. If you say water, they stay for one place. Now, the mosquito, they use water, they breathe.
Yes.
So once there's no water, they cannot breathe. They will just be growing. Then when they're a particular age, they will just die. So clear water, clear your gutters, clear your bushes. Make sure you don't have malaria. Make sure your doors are always closed. Even if you want to open your door, make sure you have net at your doors. Yeah. With that, you don't have malaria. Then go for antenatal care. Antenatal care, we say, why? There is one drug where they give you 3 tablets. Some of them, no, then they whitish, 3 of them. And they give you every 4 months, every 4 weeks. That drug is not for treatment of malaria. That drug, they go reach the placenta, where the malaria like to stay. You go clear those parasites, clear all of them, so that they no go meet your baby. Because your baby feel get that malaria, born am with that same malaria. But when they don't born and the malaria don't enter the brain, cause neurological problem, cause deficits. You see your child with a get problem, say, which winch come follow me now? Now my sister for village do am. No, it is that malaria that you refuse to treat. So go for antenatal clinic. They will give you your treatment and you feel better.
Okay. Thank you so much, Dr. Mark. My sisters, our mama, and the ones we never start to the born. This one too na education. No. When you don't marry, when you don't get belle, make you hold this one for hand. When I know they wait, make the thing come say una dey shake, una dey find person wey go hold una, reach enter inside motor, come reach hospital before una go start to take care of yourself, because nobody know the waka now una and una baby, and more importantly the baby, because the baby still dey form. You will be the mama, you don't form, but the pikin need all the support where you fit get from you. Anything like Dr. Mark talk just now, back we not say back the pain person when you get belly, but we don't know they can how the pain they be. Once the pain don't different from as it be before, no endurance. Because we start being endure well. Inside that endurance, Nine things for the spoil.
Okay.
Yeah. The next person we go talk for this matter now. The next guest now, Mr. Sam Iniobong, because our other guests they still they come for road. So, Mr. Sam, the question we dey for you now be say, okay, let's say this malaria now, it can't happen, it can't cause this learning disability. And what be learning disability in the first place? Learning disability now, all of those conditions, all of those things we go make it hard for pikin to learn for school. It go make not easy for them to understand when they teach am, or if they even they read, you know, go understand what they read, or even sometimes to write as he mate the write, it will be problem. So now this one now be learning disability or difficulty. So now let's assume now say okay, pikin can't get this kind challenge. Ogasa, how teachers for school fit use differentiated instructions and multisensory instructions to support their learning?
Okay. My people, now well done. Thank you, say, honesty, get love, join us today. As I know this program now to educate, now to advocate, to teach us about these different conditions with children and families they live with for our society, so that we might support them in every way possible. So now, you know, when Mrs. Modupe sent me this topic, even me, now very new thing to me. In short, like, oh, okay, so relationship day between these two, and no wonder recently we dey see so many children, so many. In short, you go school now, you don't need go special school, regular school. Every class, if you call teachers gather, ask them, you get pikin wey dey different for your class, every teacher go raise hand. The one wey dey struggle with attention, the one wey dey read, you know, they understand, the one wey no sabi read. So now we don't call learn the correlation, and make a chook mouth for wetin teachers fit do. I go first start with differentiated instruction. From the name of the strategy, wetin e mean be say every pikin dey different, and as we take different, na so the way we dey take learn say different. E get some people wey be say if dem sit down here now, anything wey you talk, their brain go just magnet the thing, go just catch am. Anything wey you talk, anything wey they hear. E get another person wey be say na wetin he see, now he go learn quick.
Yes.
Another person now wetin he use him hand take do.
Yes.
He go need do practical, go experiment, go outdoors, go try explain the things. Then go use their hand. Then go feel master that thing well.
Yes.
So now with that understanding of say all of us they learn differently.
Yes.
9 researchers come from this strategy, differentiated instruction. So first things first, you go feel on, you go need access to know how this pikin they take learn well.
Yes.
So for each of these children, okay, they talk about say malaria if it cause learning disabilities, if it cause intellectual disabilities. Now for each of these children, their own disabilities will be different. The way they take learn will be different. The severity of their disability will follow the different.
Yes.
So now you as class teacher, we don't deal with the pikin, they teach and they try different things. You will need to identify which strategy they work first.
Yes.
For this pikin, when I they talk, the thing they enter this ear, come out for this other ear. I be if I they explain something, give her. Sometimes if I call her one-on-one, she don't with me explain it, they understand them. If not, you go need try another strategy to say, Kai, maybe I go need use pictures or show after I don't explain, maybe I go show this pikin video. You understand? Just to try different strategies to see whether they go feel understand that thing way they take. They try teach them. If on top the talk and the show way they try show them, they still not understand. And you go need bring things enter the class. So for instance, if they teach math, and at the error way some of us they make be that for early childhood or early stage of education, preschool, nursery, early primary, you don't get business to they teach math for board. You go write and but you go use things, concrete objects,
Okay.
to help the pikin develop number sense. you dey teach pikin 1 2 3 4 5 6 7 8 9 10. You never keep 10 things make the pikin count.
Yes.
No, the pikin suppose fit associate say these numbers.
Yes.
And say if we say 1, see 1 finger. If we say 2, 1 2. By the time the pikin don associate am, then now we dey talk about hands-on learning, kinesthetic learning. Maybe for pikin wey no dey learn well based on wetin he hear, or he no dey learn well based on wetin he see. But with him hand now, maybe you go pack stones. I still remember nursery school that year. All of you must come school with your counter. They check counter for gates. They go check her. So now the pikin now go follow the using hand. Okay, as you dey count the number, you go dey count am.
Yes.
If you dey do addition,
Yes.
you go count 3 for here, count
Yes.
2 for here.
Yes.
You come teacher say addition, you go put them together.
Yes.
You know, differentiated instruction in essence na say you dey use the strategy wey dey work for each particular child.
Yes.
Say use that strategy teacher.
For am, which means we go make sure say as teacher,
Yeah.
you identify your children
Each of
well
them.
well for
Each
the
of them.
class. Then which means say, because I know some teacher go say, okay, we identify all of these children one. This one not go be extra work for us.
But now wetin you sign up for? no, true. Now why you be professional for that field?
Yes.
And I go always dey encourage teachers every opportunity wey I see.
Yes.
The same way you know go fit go like Dr. Danar office now,
Yes.
go dey teach am im work.
Yes.
Or go Dr. Bako office, go dey teach am im work.
Yes.
Person no suppose even come dey teach you your work. You suppose distinguish yourself.
Self.
Continue dey improve, dey learn. Try dey pick up strategies wey dey work globally.
Yes.
Now when you know your onions, even person from outside come sit down speak with you, go respect you because you know say this one sabi im work.
Yes.
No be say you go just dey and anything wey dey tell you now, no, you need distinguish yourself.
Yes.
The other strategy wey dey follow work for these children na multisensory teaching. Multisensory from the word sense. You remember they teach us sense organs now. Your eye, nose, mouth, tongue rather, your hearing, skin and everything. Now, multisensory be say anything wey you dey try teach, you go try engage all the senses of this pikin. So for instance, we dey here, I give example with math now.
Yes.
As you dey explain the math, you dey talk. Pikin wey dey learn quick based on wetin you dey hear, you go fit dey pick wetin you dey talk. Then you come use, maybe you dey write for board now, and you go write the numbers. Then maybe you follow get pictures or flashcards. Pikin wey dey learn quick based on wetin you see, you go fit learn.
Yeah.
Then in addition, you can't follow get children wey need do the things with their hand. It just be like to teach home economics. You dey write am for board, you know they cook or you know they sew with your hand.
Yes.
And head knowledge, when you come up for there, you don't forget am.
It.
So now multisensory teaching be say you go involve all the senses.
Yes.
As you dey plan your instruction,
Yes.
you go plan them in such a way that you go talk, you go show picture, you go do activity. So that regardless of the pikin learning style, in short, all the children, including the ones wey no get special needs,
Yes.
go fit benefit from your instruction,
Yes.
regardless of their learning style. So these are some of the strategies where teachers go need imbibe for their own
Teaching methodology.
teaching,
Method,
exactly, to fit support all the children for their class, and especially children wey get learning and intellectual disabilities.
Okay. Oga Sam, what will be the difference between differentiated instruction and multisensory instruction?
Differentiated be say for each pikin you don identify how the pikin dey take learn well.
Yes.
You don identify the pikin challenge. You don
Okay.
begin identify the pikin area of strength.
Okay.
So you go play to that child area of strength.
Okay.
So for instance, pikin wey be say maybe they struggle with attention. I remember one of the earlier episodes where we did this program, we don talk about attention deficit
and
hyperactivity disorder.
yes.
Wey dey common for school age
Very
children too.
common. Yes.
So under differentiated instruction, you ma wey don understand say okay, this pikin get this diagnosis.
Yes.
E dey struggle with attention. In attention dey lower than in typically developing peers. So when maybe they give classwork now, everybody needs solve 10 question. And you know, say, Kai, this one will lead to problem with this speaking. How we want to get this child, make it solve 10 questions with others. Because of differentiated instruction, you feel reduce him to 5.
Okay.
While others they do 10 because they get short attention. If you make can do 5, after that 5 you give a short break. Make can do the remaining ones later. Based on your attention span. So you dey play to that picking strength and you dey follow the picking pace, the picking speed and ability to learn.
Yes.
On the other hand, multi-sensory be say as you dey teach for the class generally, you dey provide instruction wey go appeal to all the senses of the pikin. So differentiated na individualized. While multi-sensory go benefit everybody because they dey use strategies wey go reach all the senses.
Okay, my people, I think when I hear the explanation now, because even me as I dey listen just now, I don't dey confused small between differentiated and multi-sensory. I know say una benefit from the explanation wey Oga Sam give. Say differentiated be say you don't, as teacher, you don't know your students. You don't know wetin they ask the way it is easy for them to learn. So you will just focus. You will build your teaching of those children or that pikin around wetin how you like to learn. But multisensory na the use of all the senses to teach all the pikin wey dey your class, so that at the end of the day everybody go benefit at their own level. And for me to add something join wetin Oga Sam talk just now generally, plus this multisensory and this differentiated teaching. Now, very important thing for teachers to make sure say their classroom na very healthy environment for all of their students. And how they fit achieve that one? The language wey they take they address their students, especially the ones wey slow, wey get learning difficulty, they very important. Because if you as teacher, you dey call your student name for the presence of inmates, now that name now they go call am. Even if you do differentiated learning, you do multisensory, it no go work, because you don't already put that pikin down emotionally. That pikin go dey struggle with that name, with the shame wey they follow the name where you don't give am. So all of those efforts, it go to waste. So wetin teachers need to do and must do be say, treat all your children, all the children within your class with respect. Not be only small pikin they respect big person too they respect small pikin. And by the way, you dey comot for house go work every day. Why you get that work? That because of the children. If those children not there, at least at that time when they do that work, you not go get that work. So your role as Oga Samuel talk be say, make you build yourself, make you empower yourself, and make you see your profession as it be, because the profession of teaching na life building profession. They build people, they build human beings, and if they build human beings, which means anything you put inside them, it will stay with them. So make una let them be say now only good things now una they put inside, because now be the adults wey dey class, the leg una carry, now everybody go carry around that pikin, you know. So we go break for 1 minute, drink water, then we go come back.
Disability. Oh, just give me a space to prove it.
So what's going to happen now? Yeah.
Get from the end, you say 5 minutes. So you
just talk. I will just cut
But
you
you not
that
go
time.
spoil anything now. You go spoil anything. Don't worry, our audience, they are generous. Okay, I'm live on the YouTube. No. Okay. Are you ready to come back? Almost. Why they rush me? No, come back. That much way don't talk. Come on, come on, beg. Come back. You know, and I almost continue. Did they hear me? It's not this one. Huh? People are what? Okay. Okay. My people, now welcome. We don't come back. So, Dr. Bako.
Yes, ma'am.
Una meet Dr. Bako last week. Dr. Bako, na our neurologist, where they help us understand all these our learning and neurodevelopmental conditions, because these conditions are conditions where they come from the brain. So on top of this malaria talk where we did so, the question for Dr. Bako be say, how malaria, because Dr. Danar talked about pregnancy now, how malaria during pregnancy affect pikin learning and cognitive ability. So as a neurologist now, from your own standpoint, how malaria, what malaria they do, how malaria they affect learning and cognitive abilities of children.
Okay, my people now well done. Good afternoon, good evening, depending on where on a day anyway. So thank you very much. So now talking about malaria. When I say malaria, that one thing where they come on for Africa. That one thing we refer to as the endemic. At any point in time, where they get malaria. And one particular age group where they think they affect most, they call them vulnerable individuals, people who get immunosuppression, and especially underage individual or person where they less than 5 years and below. Malaria, they common amongst them. And why Dr. Danar did here talk about, because even pregnant women, malaria, they affect pregnancy. Malaria alone go reach to abortion for pregnancy and the likes. So those ones are things where they're very common for our environment. So how malaria they carry cause problem for brain? The fact is malaria, how malaria they carry happen. Yes, an infection from what they call a particular parasite. And what they happen with this parasite, they infect to the level of infecting the blood. So whenever you infect the blood, because the body they pump blood to every part of the body at any time where the heart they beat. If you infect those blood cells, so those blood cells, their normal activity and mobility inside our system, they affected. Because it's just like say blood will get parasite and blood will get parasite. The activity there must be different because one they disrupted already. Okay, let's say the weight of one did more than the other, to use just common term. So most of those ones where they infected by the parasites, they easily they sequester to a particular blood vessel. Or to even go enter where the blood vessel they tiny. You see, then feet just arrange themselves to the level of weight, and feet even cause obstruction of a particular blood vessel. Then feet do that one. And again, we know inside our brain especially, now where we get the most smallest blood vessels, they inside our brain. So whenever these very infected red blood cells pass to this small blood vessels inside our brain, what thing they happen, we say, they will go block them. So is this a, if you be transient blockage, and some of those blockages as they happen, it will deprive the brain of waiting, glucose and oxygen. Ordinarily, how stroke they carry happen? If something other blood clot block a particular blood vessel for inside the brain, 90% they get stroke. So depending on where it blocks, so obstruction happens. So the part of the brain where that blood supposed to pass go reach, go they deprive of glucose, go they deprive of oxygen. And whenever brain tissue they deprive of glucose or oxygen, that tissue they supposed to supply at that time T go start get problem. If it start die itself,
Yes.
That is one part. And again, that same parasite even inside our blood system, you get what things scientifically what they call inflammation, because the body go react. You go send certain things what they call cytokines just to kill that very thing. Now, like chemical where the body through the white blood cells they feel release to say fight that parasite inside our blood system. And whenever those things happen, if you release them, you will touch other tissue, brain tissue, blood. They affect our blood-brain barrier. Inflammation will happen. So even fluid, if you move from inside the blood vessel enter into the substance of the brain, if you make the brain swell, and where can it come from? Just from malaria infection. And if the brain swell, if you cause what they call cerebral edema. And for people who don't get lost, if you need to increase intracranial pressure. Pressure if you come inside brain. Where we say, I may see some people who ordinarily get malaria, especially young people, if they in coma.
From malaria?
Yes, from malaria. That's if it just the unconscious because of that inflammation and swelling of the brain from malaria. So with all of these problems where they happen, blockage, lack of oxygen, lack of glucose, increased fluid to the area of the brain where you're not supposed to go, then automatically, if they affect all the areas where the brain is supposed to work normally. And whenever this one, and waiting predispose most of these individuals to febrile convulsion. And whenever they convulse, the blood vessel again, they go into spasm, where we say still they affect the supply of glucose and oxygen to a particular part of it. They cause more brain injury to the patient. And that, aside this one, are the direct medical part of the whole thing. That you get malaria if you go to school. I believe it's some supposed to go down. You know, go to school. That
No,
is
go
way,
school.
that if you don't teach where people where go to school that they don't get, but because you get malaria, you know if you go to school that day, so it don't affect you. Plus, otherwise, this is 2-3 days. Enough for children say, if you treat malaria, most times you combine an antibiotic and feed day for hospital for almost a week. If there's admission, cerebral malaria is the most complex part of malaria. Because some people that if it lead to coma, if it lead to death and the likes. So those ones feed the hospital for long. So it means they're waiting the other person, suppose they learn for school. Him in day they try to see how he will carry survive. So learning will be affected apart from the direct injury, like I explained and where it don't cause for the inside
For the
the brain.
brain.
So assimilation and at least will become day retarded. Ordinarily, say you get febrile convulsion, there's high tendency when you become adult self, you constantly get convulsion for reasons we know if you explain.
Really?
Yes. I mean, even one person called seizure disorder, even as 50 or 60 years, before I even think of doing brain imaging, we'll ask her that when you did small, whether they may tell you, say, within that 5 years, you never convulse because of ordinary malaria. The brain, they forget.
No, they forget.
No, you know they forget.
I hear this one. The brain don't they forget.
You forget as a person, but the
But the
brain
brain
still
don't-
they remember. You don't distort one thing which it cause problem for the future.
And if it can't happen again in the
They
future.
happen now. We go send you say go do brain imaging. You come back say the thing they very clean. When they convulse, we don't get explanation. We go do your electrolyte because another thing they cause electrolyte they come intact. Now there will start finding everywhere. Then you see someone, hey, my mama boy she don't die, but that time they be say like this, and most times that's so. The brain always remember. Because this is that spasm, they cause deprivation of oxygen, glucose, they cause many injury for inside the brain. So with that, even the child will develop, they say the affecting assimilation, how others will feel understand something, he may go need extra time to understand and everything, forgetfulness, memory impairment, just because of malaria. If we get this very true and prevent our children from having all of these complications, they say their learning and cognition will be seamless. But if children, they always get so cognition and learning, but they very, very much problematic for them. You see, for person in the same age with while waiting if you assimilate, with person who they frequently they get malaria. Then begin with they always go down with malaria. You see, say waiting down if you assimilate, the other no if you assimilate, and because of all of those things we are trying
What
to
happened
explain
to
and
the
the
brain?
injuries and everything where they cause for inside the brain. Just malaria. So
Oh,
malaria
wow.
is something you're supposed
Malaria not be
take
just
serious.
though.
Now what you're supposed to take very serious for our environment. Thank you very much.
My brother. Now what you really need to take serious, well, because not be just at all.
At all. You know,
It's
it's
not
not
just.
just.
though. It's not just because your
And the brain
explanation
no dey
now.
forget.
No, the
That
brain no dey forget.
one, now if you hear me pass, say
You
the brain
dey
no dey
forget, but the brain no dey forget.
And wetin happen for small pikin go come repeat itself and
For
adults.
adults, yes. Yes.
My people, make we not take malaria joke o. Make we take am seriously because where e dey reach for body no be small. If you get headache, you get fever, treat am quick. May e no be say your brain go go remember wetin happen for small pikin. E come dey give you problem when you be 50, 55, 60. So, Dr. Kumtap, welcome, sir.
Thank you very much.
Your face don scarce well. But thank God say we see you
I
today.
don't come back.
So Dr. Kumtap now be chairman for the Nigerian Medical Association. So your question today now na government question.
No, that kind of question if it's
As I see am, I say.
policy.
So see now, malaria, they say brain no dey forget.
You know they forget.
Malaria, if you do something, not be only say make person no feel learn well, if it cause coma.
Yes.
So, but all of this one now, waiting government, waiting be government work now to reduce all of this malaria problem. And when all of this kind of situation don't happen, especially as it relates to the learning disability and cognitive aspect, waiting government go fit put in place to take, help these children and their families.
Start from pregnancy.
Okay. God bless you, Dr. Danar. Oh yeah, hold on. Let me government man we will get for you. Hold on. May talk where.
If I want to start to talk about government, I always they talk say government they try
Okay.
at their own level to do waiting they fit do.
Okay.
But I dey also remind them say waiting then they do no do they enough. As we don't hear waiting malaria fit do. In fact, government they aware of all these things,
Yes.
and you don't they put plenty strategies. If we remember the history of Nigeria, how the white man don't come enter Nigeria. In fact, now malaria start to they deal with them as they enter. So the problem of malaria, you don't take. And unfortunately, for us for Nigeria, the burden of malaria too plenty. In fact, 27% of the entire malaria we did this world, they for
Is that Nigeria?
Nigeria.
Yalla.
So it means say for every 4 people for this world we get malaria,
One in Nigeria.
will be Nigeria.
Okay.
And then 30%, in fact 31% of all the people we don't die from malaria, then the deaths now for Nigeria. So the burden of malaria in Nigeria really they plenty. And government clearly understand all these things, and then they put in place things how they will take eradicate malaria. You get one program within they call the National Malaria Elimination Program, where
Okay.
it don't start since 2014.
For just here or national?
No, for Nigeria,
Nationwide.
the
Okay.
nationwide.
Okay.
The initial target we say for 2020 we go down eradicate malaria, but we don't push them now. Reach 2025.
Fine.
That malaria elimination program they go end by December 2025.
And people say they die today.
Waiting be the target of that.
Okay.
Now to ensure say they don't reduce malaria by as much as 80%.
Okay.
No, they talk say malaria free, but if it reduce malaria by 80%, then now good thing. So the strategies now be say then the one now to prevent the malaria,
Yes.
because how malaria they spread now be say if mosquito go bite person we get malaria,
Yes.
and then you go bite another person we no get malaria, you go put the malaria parasite
Okay.
there. So if we stop that transmission, it means say eventually we pick up the malaria.
Malaria.
Yeah. For other countries, they no get malaria completely, and they get strategies
What they
use.
use.
So they try to adopt some of these government they try to adopt them. So now prevention and how will they take do the prevention? Then they encourage the use of insecticide treated malaria nets, insecticide treated nets. Okay. So then they distribute them from time to time. Then they distribute them to people. But like I say, they enough.
Yeah.
So we need to increase that strategy. Yes. 2, now ensure that we don't have stagnant bodies of water around houses. So sanitation strategies now another thing. Because if we stop transmission, eventually the mosquito gets its own lifespan.
Yes.
So if mosquito complete the lifespan, it no go bite anybody, it go die and it no go transmit the disease. That's another one strategy. The second one is seasonal malaria chemoprophylaxis. That means then they distribute malaria drugs for prevention. Okay. So it gets seasons where malaria they plenty. Like now, as the rains don't begin, they start. Waters go start to stagnate. Gutters go start to they block. So grasses they grow around houses. So malaria, the transmission they increase. So during this season like this now, the government they distribute chemoprophylaxis, particularly to women and children. As Dr. Danar says, same will talk about
Pregnant
women.
Pregnant women.
I sure say he don't talk. Say even for pregnancy, he get them for every pregnancy they give malaria prophylaxis, prevention. So any woman will go antenatal. Now why would they talk? Say make women
May they go antenatal.
That antenatal is a very important thing because one, it they cop the malaria. Two, those complications where they come with pregnancy during delivery, they reduce them. So eventually, most women where they attend antenatal, they help us in fact, now serious advocates for us in reducing disabilities in children because most of these things we see them now during the first year from birth to 5 years. Most of the times these things now during that period they happen. So we they encourage the women they go antenatal. Now the second thing that we say then they intensify treatment. That means anybody will get malaria. They ensure say make you go do the test. In fact, you get what we call RDTs, that's rapid diagnostic test. Where within minutes test result will come out. Once it is positive, then they will give you the treatment. So if they treat them, then they eliminate the malaria the malaria parasite out of the body. So now the main strategies where government they employ with that. So prevention, seasonal malaria chemotherapy, and then prompt treatment of detected cases. Then of course they do monitoring and evaluation. They see whether we they get results because the program is supposed to terminate for 2020, but because we know reach where we supposed to, we don't extend and reach 2025. And I pray say by December we don't talk say at least we don't reduce malaria significantly. So government they try to do, but then all governments at all levels. So made a no limit only to federal government, state government suppose they involve, local governments too suppose they involve in these strategies so we will take reduce them. The second part of the question now, the policies where government fit implement generally to help reducing the incidence or the issue of disability and in children. Now this one where I don't talk about malaria now one. The second one now, we need to intensify advocacy like I earlier said on pregnant women. So I go talk say maybe them Dr. Danar they know they do enough because
Dr. Danar, you said I know they do enough. Okay.
They know they do enough.
We go talk after.
So
we could not give me contract.
So government should target these vulnerable groups.
Yes.
Pregnant women 0 to 5 years. If we target them, then we'll go help this. What they fit do? We fit ensure say treatment now free for this age group.
Yes.
So imagine say pregnant woman know say treatment now free. She go just go.
She go just go
for test.
Go test.
Yes.
She go for test. Because whether husband give her money or she don't
give her money, she go.
She know say government don't handle that one. So now important thing. For here for Plateau say I like waiting they do, but I don't know whether they have. You get for every pregnancy say then they give you mama kit. Mama kit, where they don't distribute them to all pregnant women because during that antenatal too, before delivery, they go talk say make you buy some certain things. So Plateau say government don't buy.
Okay, don't buy them for them.
But I know I'm not sure if now every woman they get them. But if we make that pronouncement and then back on with funding, say all children and pregnant children below 5 years and pregnant women will have free treatment in any hospital, whether government or private. If they would. More no limit them to government. Yes. So for private, another thing that ensures say everybody they insure. They insure. So insurance. Now another thing because once everybody they insure, most of these things could they reduce. Now poverty they push people to say he, she, the woman, say me I be Hebrew woman. Now poverty
That guys that try to dodge.
Now poverty they
I like
but
this.
if she knows say if she knows say she will go, then go give her epidural.
Yes.
She go deliver painless. She
Na
know,
poverty, oh, I
na
agree.
poverty dey cause am.
Yeah, poverty.
Oyibo dey go
But you escape the need of all those prolonged
By the time when they go tell you how much you go pay
how much you go pay
for CS,
I say,
you
make
go
you
run.
do CS. You say no.
CS, yeah.
Say you want to
You
deliver.
You want deliver?
na money minimum wage na 70,000 naira.
Yes.
CS if you go they go say 253.
Yeah.
500.
500,000. Where na poverty dey cause
Na
all-
poverty.
yeah. So we need to improve the economic standards.
Oh, yes.
Yeah, bring down cost of living, improve the economic well-being of Nigerians. Then we will fit help people to overcome these challenges. Where I sure say they are surmountable.
Yes,
fit,
they are.
Yes. So I think now which I could talk.
Yes, so you
as
talk
una don
plenty.
talk
Oh.
say me I be policy maker.
Yeah. Now you be government man, and Dr. Danar, he join me because he tell you where you go from start. Because he know say you know you go fit give answer because true, like you say, government don't put something for ground. Now make it continue, make it no stop, and insurance. I strongly believe go get huge role to play for all of this one, because if mothers wey get pregnancy, wey get pikin 0 to 5, fit get assurance say anything wey dey wrong with their pikin, government go take charge. Many things go fix because even the therapists, if the disability don happen, all the therapists wey dey go na that age range, na be the early intervention stage. Now that stage now you need all maximum support to take help the pikin comot from the dangerous stage where they come place where be say e go fit still do plenty things with e life.
Yeah.
So if access dey for health for family,
Yes.
because money na very
Na-
very
na
important
very
thing for all of this one wey we dey talk so. If parents fit get that support from government from pregnancy stage all the way to age 5, we go reduce so much the incidence and even the stigmatization. You know, the pain wey dey come with all of these conditions. Because if insurance dey, we go give you opportunity to do therapy, wetin you go dey sit down for house do? Nobody go dey talk say you wan pray. Like you said, na money. Na money dey cost plenty talk. If you get money wey you wan spend, you no need to tell anybody anything. You go carry your money go where you go find, you use am take help yourself. So my people, na don hear Dr. Kumtap o. And also, even though the question when I ask na question for government go do e own, we must do our own. We must do our own. And that our own, e dey inside, especially wetin Dr. Danar talk just now. Pregnant women, if una see as una body dey change, at least una go the hospital go ask question first. Una go the hospital go ask question. Make una no dey house manage. You know? Then if eventually the pikin e can't get issue, family make una accept the condition. Because if una not accept the condition, I no go fit think of solution. And if una not accept that condition, I not think of solution, everybody go dey suffer. And that solution one I no wan think about. Now go think about later, but it go done too much. Because all of the other behavior wey for not come at all, it will come add. Because those now ways for the pikin too to fit survive. Not be only big person won't survive. Everybody dey against this one pikin because he gets condition. That pikin too go dey look for ways wey go take make himself happy. But your happiness na problem for you. Na big problem. Because the problem go dey, the behavior problem, it go dey increase. Now you call am behavior, you call am happiness. So the earlier we accept, say, okay, now what did this pikin carry come be this? Then we will come sit down. As we dey pray, we dey walk, we dey ask questions. At the same hospital now we go. See, oh, this pikin matter don't be like this now. I beg, how we go fit take manage the condition. From there, you go get advice, you go get direction. And when they give us this diagnosis or information for hospital, make we not hide them from school. Because that one another thing where parents too, they do. You know, everybody they see this pikin, say this pikin, they get difficulty with things. But the pikin, the papa and mama go, they make excuse, say, no, maybe because he not quick sleep yesterday. Now every day, they know they quick sleep. Not every day, they quick sleep now. So, if question there, let us know so that we will answer the questions for our listeners. So, so my people, today we don't talk about malaria. We don't see how malaria takes serious. So not be waiting person they take play. So when I do say when I join us, so this one this talk now from Beautiful Hands Foundation. My name na Mrs. Afiz Ogun, Mrs. Modupe Afiz Ogun. I may be CEO founder of Beautiful Hands Foundation. And I hope so all of us don't learn one or two things from here. So I will let my guests, Dr. Bako, don't come out leave us because he gets place to run to. So I will let our other guests tell Una bye-bye before we close the program. So Dr. Danar.
Okay. I greet Una again. As we don't hear, we stop like that so that all of us go remember what you discussed today. And I said, all my pregnant women, go antenatal. Some things they there when they will give you free. Go. Government is spending a lot to prevent our children from coming down with complication and developmental issues. Go to antenatal. Prevent malaria. That small chingly thing. Prevent them so that our children will live better.
Thank you so much, Doctor. Ogasam.
My people, are well done. Thank you, sir. And I don't follow us reach this time for the program. And just the same way we wanna take the learn today. Now so me self learn with this malaria thing. We say we self don't get see finish for the thing. But now we don't say malaria no be common something. No be just malaria. Malaria dear where. So we look forward to seeing on our next week. Thank you.
Okay. Yeah, you got questions. So
yes, what will be the question now?
So I go answer the question and
okay.
then close.
Then close. What will be the question? I'm not saying. Okay, you say at what stage can malaria affect a child?
A child. Okay, so any child that the malaria can affect a child even in the mother's womb. Yes, so it can start as early at that time.
Yes.
So we try to avoid them because if they give them if it happen from when pikin still dey stomach where the inside womb, then if it affect if it come out anytime. So it can come anytime. When I don't hear malaria in a serious matter, and anything we fit do, we do them. We don't hear how we fit prevent malaria. Let's keep our environment clean. If you get symptoms of malaria, fever, anything, may them go hospital. Women, they go antenatal as much as, and if you go hospital, no go keep quiet. Go ask questions. Anything where you don't understand, ask. Now our duty as doctors, as nurses, as healthcare providers, we educate one so that we will take joint hand, prevent all these things where they happen to our society. Thank you.
Okay, my people, now do well. God bless you now. God bless all of us. So we go see again next week Saturday by 3.